So this is a short video to help you assess patients with sudden sensorineural hearing loss. Sudden sensorineural hearing loss is a hearing loss that takes place in under 3 days, usually in one ear, and is important to recognise because it needs urgent treatment with steroids. Now, of course, sudden hearing loss could be due to a conductive cause and not necessarily sensorineural, and of course may also present just with the feeling of a blocked ear. So it's important that these patients are seen face to face so that they can be examined. Now, if the ear canal is clear and the eardrum looks normal, then you should move on to a tuning fork test ideally in order to determine that the hearing loss is sensorineural.
We've also developed an app which is available on the app stores, which both tells you how to do a tuning fork test and allows you to interpret the results and guides on management. If you don't have a tuning fork, you can simply ask the patient to hum. That replicates the tuning fork, and if they hear it on the side of their hearing loss, that's conductive loss. If they hear it on the opposite side, that's likely to be sensorineural. And that test can be done over the phone just as well as it can face to face. If you do see a patient who's got a suspected sensorineural hearing loss, it's really important to refer that patient urgently, and that's best done to your local hospital ENT service on-call team. We're part of a team delivering a large national NIHR-funded study looking at the best treatment for patients who have a sudden sensorineural hearing loss, and that's going to be available to patients at about half the hospitals across the UK. We're really encouraging people to refer patients promptly, and they might be eligible for the Starfish trial, and you can find more information about that on the web link shown.